My name is Donnell Lewis. I'm the director of the New Vision Service here, which is an inpatient drug and alcohol treatment service. I have 12 years experience in addiction. This is my passion. I've worked with the Federal Bureau of Prisons, the state system, and then managed the outpatient drug treatment center. Alabama is ranked #1 per capita in diversion of pain medicine. And basically what diversion is if I have a prescription for pain medicine and I share it with you, that's diversion. That's illegal, it's against the law, you can get federal prison time for that. Alabama ranks #1. The reason Alabama ranks #1 is because heroin was not in Alabama. Now we are seeing an influx of heroin in Alabama because it's actually cheaper than they're selling the pain pills for. It was a progression with addiction. First, people would swallow the pills, then they would chew them, then they would crush them and snort them, then they would shoot them intravenously. Now, the young people are going straight to intravenously. There's no going back once you start injecting the pain medicine. When I first arrived, I did an interview with Yay 106. They asked, why did we choose Coosa Valley? And then the answer was simple. We chose Coosa Valley because Coosa Valley cares. Coosa Valley is a community hospital. Coosa Valley reaches farther than just Sylacauga. People depend on Coosa Valley. We saw a need in this area for drug stabilization or medical detox. So that's why we brought this service to Coosa Valley. I was at Jackson Hospital in Montgomery, where you can imagine the patients we had there, and now we're in Coosa Valley. Now, you personally may not need this service, but your children, your grandchildren, your neighbors, anyone in your community, because we care. Coosa Valley cares. We're not trying to have you go to Birmingham or Montgomery or anywhere else for this service when we have it right here at Coosa Valley. Now, our service has 3 facets to it. We have an assessment where we evaluate each and every patient to determine whether you qualify for our service. Then we have the medical stabilization. Dr. McCullough is our medical director. What we do, we treat for alcohol, benzodiazepines, and opiates. What we do at that point is we keep you from going through withdrawals. That's the whole reason why people are addicts in the first place. They don't want to go through the withdrawals. They don't want to experience those terrible withdrawals. Imagine the worst flu you can have, the very worst flu. That's what withdrawal symptoms feel like coming off of benzodiazepines or alcohol. Now, if you imagine the worst flu symptoms you have and add pain to it, that's what withdrawal symptoms feel like when you're coming off of opiates. So, and then the final piece of our service is the aftercare. That's the most important piece because we're dealing with the medical and then it's the psychological piece. Everyone doesn't need the same aftercare. We don't cookie cut our aftercare. We tailor it, we individualize to each individual person. Some people may need counseling, some people may need therapy, some people may need a psychiatrist, some people may need a longer term inpatient, some people may need 30 meetings in 30 days, intensive outpatient. It just depends on what that patient needs. For example, if someone broke their back in a car wreck and they were on a morphine pump for 6 months, they're going to need a different type of aftercare than someone that was using drugs recreationally and then they started using. Same thing with someone that was abused and they're running from their abuse and they're taking pills or trying to escape that. They would need counseling or therapy, and the other person would need a psychiatrist because it's more of a mental addiction. And basically what we do is we link that patient with aftercare resources so that they can get the most in their quest for sobriety. Now, the shame, it is a negative stigmatism attached to getting help. And that comes from the community and other people on the outside looking in. And what we try to do is we try to eliminate that stigmatism to let you know there is no shame in getting help. There is no shame in admitting you have a problem and saying I need help. The shame comes in when you keep doing the same thing over and over and don't get help. That's shame. When you don't get the help that you need. Coosa Valley, once again, real quickly, Coosa Valley offers this service for the community. It may not be for you, It may be for your children, your grandchildren. If you have prescription meds, and every time you get this certain visitor, when they leave, you have less medicine than you had when they came, that's a problem. It's not disappearing. That person, whomever it is taken. And they will, and when this addiction just ravages a person's life. And finally, I get this question asked a lot from doctors, from therapists, from counselors. How long does it take to become addicted? That answer varies. As soon as you stop taking the medication for pain relief or for anxiety relief and start taking the medication for the euphoria it gives, that's when you're addicted. It could be 1 day, it could be 2 weeks, it could be a month, it could be a year. But as soon as you stop taking that medication for its intended purpose and start taking that medication for the euphoria it gives you in your brain, then you become addicted. Coosa Valley is a hospital that cares about the community, and we're here to offer this service for you and your loved ones and the community abroad. Thank you.
I've spoken to this group a couple of different times, and it's so good to be back with all of you. I love this great group of people. Vanessa started out the program asking a lot of questions, so I wanted to ask a question or two. When you think about your healthcare visits, do you as a consumer, you as a patient expect average care? Raise your hand if you at least expect average care. Okay. What about good care? How many of you expect a minimum of good care? Most of us here, our minimum is good. How many of you in this room expect excellent care when you go? Okay, a lot of you do. You're ahead of the ball game here. I talk with my staffs all the time about the difference between providing good and excellent. And at Coosa Valley Medical Center, we all strive day after day to provide you with excellent patient care and excellent patient services. And when we do that, we see great things happen. We see great things happen for you, and we see great things happen for our hospital. So Vanessa wanted me to highlight a couple of bullet points about MRI services as well as our hematology and oncology services so that you won't forget us through the summer months. So let's talk a little bit about MRI. Our Siemens service engineers tell us that we are the busiest MRI scanner they serve in Central Alabama. We average 5,000 scans per year and hold a 97% excellent patient satisfaction record. We accommodate the working person, the athlete, the school teacher, and all of those who prefer an early morning appointment. We open 7 a.m. to 7 p.m. Monday through Friday, and then on Saturdays from 8 a.m. to 12 noon. Another neat thing is that we offer same-day and work-in appointments. Sometimes when you go to the doctor's office, there's a situation that you need an MRI right away. We will take care of that for you. The referring physician calls us, we get you in same day if you need that service. Our MRI scanner is an ultra short bore, and actually we had one of the first in the state of Alabama. The ultra short bore is a super short tube. It's only 4 feet 4 inches long. And what that would mean to all of you is that there are more head out exams. And everybody always wants to go in feet first with the head out. Am I right? Because it makes you happy and it makes us happy because you're happy. Our average scan time inside the bore is 20 minutes. And for your comfort, we can stream your favorite Pandora music as you're scanning. So I'd like to be able to offer you some tea and those kind of things as well, but maybe the Pandora music will suit you well for that time period. Results are sent to your referring physician fast. We guarantee within 24 hours. You know what? Your doctor needs those answers very quick so that they can develop that treatment plan for you. So that's our goal. We try to get them to your physician very, very fast within 24 hours. And we offer a CD of your images free of charge at your request. Most insurances at Coosa Valley Medical Center, as well as we provide private pay options and payment plans. That's important, folks, because there are a lot of people that don't have insurance. So please know and spread the word that we do provide those pay options. And lastly, it's really important that you know that you have a choice where your physician sends you for an MRI. If you want to receive that excellent care that we're striving for at Coosa Valley Medical Center, let your physician know that you want to have your MRI close to home, in your community, in your area. All it takes is a phone call to us, and we'll handle everything else. We try to make it easy for you and easy for the referring office. Moving on to oncology. And I think, Vanessa, we've had Dr. Yielding out and myself out earlier, previous months ago, speaking a little bit more in detail about our oncology and hematology program. So I just want to kind of share a couple of highlights to keep you on that reminder phase as we go through these summer months. We all know, for some reason, that we have a high incident rate of cancer in our state and in our county. I'd like to research that one day. I have some thoughts and ideas, but nonetheless, we see lots and lots of cancer cases. And as of October 2014, the senior management team of Coosa Valley Medical Center saw a great need to make cancer treatment part of our continuum of care. Patient visits have grown by 50% since then. You know, earlier I talked about great things happening. That's the difference between average good and then excellent. And when you stick to that excellent course, great things are going to happen. So we have more and more patients coming to see us, and I'll share with you a couple of reasons why I think why. We're grateful to have some of the best oncologists on board to serve our patients. Dr. Yielding, Ashraf, Bridges, and Mooney are board certified with over 50 years of experience practicing new age therapies that target the specific disease. And folks, this is the exact same therapy and the exact same treatments that you get in Birmingham and Atlanta and other places. And we have it right here in Sylacauga, Alabama, and we're excited about that. We experience better patient outcomes because of this, quality of life and longer lives due to the comprehensive offerings and the expertise of our physicians and nurses. Our team of physicians have strong relationships with transplant teams at UAB and Emory and other teams in molecular biology. All of these things, all of these connections and relationships are so important when it comes to great outcomes and success outcomes with our cancer patients. Our patients come first. We help manage their chemotherapy, radiation therapy, surgery, immunotherapy, hormonal therapy, and other diagnostic and monitoring testing. And by the way, I think we talked about this in previous events, but Coosa Valley Medical Center has probably one of the best radiology departments. We have almost every diagnostic tool that we could possibly need for diagnosing and staging cancer. So we certainly can get you connected with those services if we find it necessary. In addition, we have somewhat of normal operating hours. We're open Monday through Friday, 8 a.m. to 4:30 p.m. And we work with each individual to meet your personal needs. That's important. I don't know that you always get that everywhere else, but when you call or when your physician office calls us, we work diligently to make sure that your appointment and your experience is catered to your needs. And lastly, well, before that, I want to share with you, we are growing. As I mentioned earlier, we've had a 50% increase in total patient visits. We've got an enlarged vision for the program's future. We're excited about what's to come and what we can offer to the state and to our community. And then lastly, as I mentioned with MRI, it's important to know that you too, with cancer treatment and diagnosis, that you have a choice. You can let your physician know, I want to stay close to home. And when you're close to home with your loved ones and the people that you know and you're not driving miles and miles, that reduces your stress and it gives you a greater peace of mind. And those of us who have traveled that journey of cancer or know somebody that has, that means $1 million. When you can feel peaceful and comfortable while you're taking treatment, because certainly as we all know, a positive mindset and less stress can promote healing. And that's certainly what we want to do when you come to see us at our hematology and oncology department. Thank you very much.
All right, thanks for allowing us to come back. I always enjoy coming to speak with y'all. My name is Tommy Ponder. I'm one of the physical therapists at Coosa Valley. And we just want to take a minute to let you know that we're here to help you with any type of ache and pain that you might have. The days are longer, the weather's nice. I know a lot of you want to be out doing things, working in the yard and stuff like that. Don't let any joint pain or arthritis slow you down, okay? Come to see us. We can help you get back on your feet. We have several right now who are, wanting to get back into the yard work and stuff like that. So we're working every day to try to get you back to your goals. Also, don't forget, I'm a certified McKinsey therapist. So I specialize in back and neck problems. So I know that many of us have neck and back problems. And if you have something and it's just not going well, call me, come see me. I'd love to talk to you and see if I can help you out, okay? I'm going to turn it over to Brian, our occupational therapist, and let him talk to you a little bit.
Good afternoon. Yeah, my name is Brian, I'm an occupational therapist. So with that, I'm an upper extremity specialist. So a lot of arthritis attacks us first, a lot of times in our hands. We're starting to lose the ability to work in the kitchen or work and clean the house, whatever it may be. You can come and see me. We can work on increasing that strength, work on decreasing the arthritis pain that can really limit life. I also treat orthopedic injuries, so if you've had some shoulder problems, elbow problems, you can definitely come and see me for those as well. I think I'm like the only occupational therapist in the county for outpatient services. So if you do have any upper extremity needs, or you know somebody that does have those needs, please come and see me. Also work seamlessly with our doctors. We are in that first floor of the cardiac clinic, so it makes it really easy for us to get a phone call, FaceTime. So your continuum of care, that excellent quality of care, really comes from the team approach that we're able to provide down there. Again, having all of us right there in one room. We do have some information and some cards over there. Please take one with you. Again, if you have any questions, concerns, or need to know how to come and see us, just ask us or give your doctor a call and say you want to come to Coosa Valley Therapy. Thank you for having us. Yes, ma'am.
What is the difference between physical therapy and occupational therapy? Is it both ways?
Probably like Brian said, occupational therapy is really devoted to the upper extremities, okay? So hand problems, shoulder problems, anything like that. But also with activities of daily living, instrumental activities of daily living, like brushing your teeth, combing your hair, getting dressed. All that kind of stuff follows in under occupational therapy. Physical therapy, really anything head to toe. So, we deal with the upper extremities too, but since we have a full-time occupational therapist, that allows physical therapy to handle more of the lower extremity stuff, the back problems, the wound care, a lot of that type of stuff. So we work really well together, but hopefully that answers your question. We can go a long time on this, but that's
I had a broken shoulder, and that's where I took mine. It was excellent.
All right. Did that answer your question?
What?
Did that answer your question?
Yeah.
Okay.
Hi, my name is Dina Ford. I am the office manager, so I have the joy of putting up with these guys and keeping them in line. So I'm the most important person. Just kidding, yeah. But I am going to touch base a minute about our speech therapy program. We have an awesome speech therapist. Her name is Shannon. I know a lot of you probably know her. She's not with us today. So I am speaking for her. And she treats kids of all ages. And I mean, you guys and kids of all ages. She treats anything from stuttering to children with autism. If you're hoarse, and you have something going on, maybe you've had some kind of oral cancer, she treats all those things. If you have swallowing problems, those can be treated by the speech therapist. If you feel that you have some kind of issue that maybe you need to see a speech therapist, then, speak to your doctor and voice those concerns, and they can refer you to see Shannon. You'll call the office, we'll schedule you an appointment, and you come in, and she evaluates your need and treats you the best way that she feels that needs to be treated. We also, like somebody said, we take all the insurances that the hospital pays. There's so few that we don't take, I can't even think of any right now. I deal with all the insurance up front, so we actually verify your insurance before you come in for your appointment. When we call to remind you of your appointment, you can ask us, hey, how does my insurance pay? And we'll have that information for you before you come. If you have a copay, we let you know before you even come in for your appointment. So you can, just like I say, if your doctor gives you an order for therapy, you can take it anywhere you want to go, but we hope you come and see us, because we provide everything you need under one roof. And we try our best to get you in as fast as we can for your appointments, and we work around, your schedule. Tommy starts at 7. I'm not there at 7, I see you guys around 8. But, we have therapists that stay late, so our last appointment may be 5 or 5:30 later in the evening. So we do our best to work around your schedule, because we try to reach out to everybody, and we've got kids that need to get to school. We've got people that, need to wait till they get off work. So we do our best to work on those schedules. So y'all call us and we'll take care of you.
Hi, I'm Michelle Kane. I work in cardiac pulmonary rehab. And what we do in cardiac pulmonary rehab, we work with patients that have breathing and heart problems. So all our patients either have heart attack, stents, bypass surgery. We have some patients also that has had heart transplant. Then also with our breathing patients, they either have asthma, emphysema, COPD, and also some that have had lung transplants. And I know we have a lot of ex-patients in here, and we just, in our department, we exercise 3 days a week on Monday, Wednesdays, and Thursdays, and it's just a good family atmosphere. The good thing about it is that you're able to exercise with people that have the same problems, just at different stages. Some patients may come in and work out 36 visits, or we have some patients that may only, with their insurance, may allow them to work out 12 visits. So everybody's at different stages. And it's just a good, friendly atmosphere. And I think, most of the time, anytime any patient comes in, even physically, if they have problems with their back or their legs, we have exercise that's available for standing and seated exercises. And also all our patients, whether they have breathing problems or heart problems, everyone's hooked to the heart monitor. So myself, as well as Rita's filling in for Jody, because I know a lot of patients know Jody Klein, that she's usually here with us, but she's not with us today. But she's here, we're both at the rehab, and we're always monitoring your heart, whether breathing or lung problems.
I can just say that we work by referrals. The doctor will make the referral, and then one of the nurses will do the evaluation. And like she said, it's a family atmosphere. I just fill in for Jody, and I love working there because everybody's together, everybody exercise and talk to each other, and they know each other. And one was missing today, and they were looking for where he was. But it's a good atmosphere. You would enjoy coming. And exercises are modified. Like if you can't do something, they're modified for what you can do. So you don't have to come in thinking I have to do this and I have to do that, because it depends on what you're able to do. But we would love to see you if you needed cardiac rehab. It's a great program.
Actually, I was going to start off by saying how many in this room did not know that we had a sleep disorder center right here in your backyard at Coosa Valley Medical Center, but she's already asked that question, so it seems that everybody in this room already knew that, right? Because nobody brought that up at the beginning when she said, you didn't know? Okay, I found one. Our center has been open actually over 10 years, and I find it amazing that every time I speak to a group, I always find someone that did not know we had a sleep disorder center at Coosa Valley Medical Center, and I actually stole the marketing team's line by saying in our backyard, if you've seen our big billboard, we have all these services available in your backyard, so there's no need for you to travel up the road. And I want to ask you a few other questions I want you to think about. And Vanessa's already touched on that a little bit too. Isn't it amazing how much she knows about every department at our hospital? During your sleep, how many times do you snore during one night? And usually it'll be someone in the household that lets you know how much you snore. How many times do you stop breathing during your hours of sleep? How many times do your legs jerk or move? You may can answer yes to some of these questions. On the next day when you wake up, how many times do you feel like you just didn't have a really good night of sleep? You might could say that when you first wake up in the morning. Do you wake up with morning headaches? You know, sometimes you may have that. Do you just feel really tired all day? And maybe you fall asleep doing things that you shouldn't fall asleep doing. Maybe you're trying to watch a movie with someone in your household and you can't stay awake, you just fall asleep. Well, if you've answered yes to any of these, you may need to think about maybe needing our services of the Sleep Disorder Center. And again, Coosa Valley Medical Center has a Sleep Disorder Center. We've been open over 10 years. We have qualified staff. We have registered sleep technologists. We have a board-certified sleep physician. And they're there to serve you every day. We have our technology. We keep upgrading with the newest technology. Actually, we're having a new install of our newest upgrade to our technology in our sleep center on Monday. We start a new upgrade on Monday. So we have newest technology available for your studies. We're also accredited by the American Academy of Sleep Medicine. We're proud to say that we're surveyed every 5 years, and actually this is the year for one of our surveys. So we're expecting a survey again by the American Academy at the end of May. Our patient experience surveys, we have a 99.8% patient satisfaction on our surveys. We have lots of positive comments within our center from patients that come and spend the night with us. So if you need to be diagnosed, if you need treatment for your obstructive sleep apnea or any sleep disorder, we can offer you the diagnosis treatment as well as follow-up visits. We take care of you after the fact. We have follow-up plans where we can take care of you. And one of the advantages, too, of our Coosa Valley Sleep Disorder Center is that we're able to pull from all the services that we have at Coosa Valley Medical Center. There are some freestanding sleep disorder centers that can't say that, but as part of Coosa Valley Medical Center, we have all the services in our facility available to our sleep disorder center, which I think is a big advantage for us here in our hometown. Also, I wanted to point out that as a sleep disorder center versus a lab, we're able to treat all sleep disorders. So the obstructive sleep apneas, the narcolepsy, insomnia, restless leg syndrome, periodic limb movement, we can diagnose and treat all sleep disorders. And with Dr. McLeod, who is our board certified sleep physician, he can take care of all areas that you may need help in. I wanted to mention too, with our program that we have set up at Coosa Valley, we can take self-referrals, which means if after you leave here today and you've listened to what I've said and you say, hey, I think I need to be evaluated for a sleep disorder, well, you can just call our sleep disorder center and do what we call a self-referral. We will schedule you and take you through the program, and we will send your information or feed your information to your medical doctor. You give us that information as well. And a lot of centers don't have that self-referral program, so that's an advantage to us as well. And I wanted to also mention that we have what we call a take a sleep test. We have some of these available on the table if you've not already picked one up. It has a lot of questions that you can answer, and on the back it kind of gives you an idea about which questions. It kind of helps you diagnose the sleep disorder that you may need to have.